Hi, my name is Terry and I'm one of the exercise specialists here with the Edmonton West Primary Care Network. Today we're here at the Terwillegar Rec Center. We're just going to walk you through some of the things we do for our Supervised Exercise Program. So this video is going to be intended for you to kind of know what to expect when you come into the exercise program, also just to affirm some learning you've had along the way and give you a reminder of the exercises that we did. So we're going to go through some more advanced exercises that we would normally teach in the second half of the program, such as free weights, cables, and some additional leg exercises. Do keep in mind though that the exercises I'm going to show you today are just a base example, and the things that you may actually do in the program could be a little different depending on your goals and your limitations. So for this video, we're going to go through some of the free weight exercises. So cable machines are a form of free weight exercise because the cable machine is a little bit wobbly and unsteady. So I tell people that working their wobbly muscles, you may feel a little bit wobbly or unstable because they're muscles that you're not used to working. So for this one, the first thing you're going to do is set up the cable so it's about your chest height. So for me, this is actually quite good, but how you would do it is you're going to push up a little bit on the machine, lift, and move the cable where you need it. There is little numbers along the side of the cable, which is great because then you can see on the other side that you've set it at the same height. So first we're going to do the chest press. Our chest muscles are responsible for pushing our arms out and together. So that's what we're going to do for this exercise. So the first thing you do is grab the handles, and if the handles are not on, you just open up the carabiner and slide the handle on. So we're going to grab the handles here. Some people just start walking out and it's pretty hard and uncomfortable, so the first thing I do is just give myself a hug first, and then I walk out a bit. To make this most stable, I like to stagger my foot position. So I'm going to bring the handles close to my armpits, push forward and together and come back, push forward and together. So this is the cable chest press. Again, at the end, once you're done the exercise, you're going to give yourself a hug and walk back. You don't just want to let your shoulders fly back at the end because that can be pretty unstable and uncomfortable for your shoulders. We don't want to cause an injury. So next up, we're going to do the standing cable row. So for this one, again, the same height should work okay for this exercise. What you're going to do is just turn the other direction and grab the handles. Then you're going to walk back. I like to sit a little, like pretend I'm sitting in a chair just to get nice and stable. Then you're going to pull and squeeze your shoulder blades together. Pull and squeeze your shoulder blades together. Again, on this exercise, we're going to be looking for vertical lines in the back of your shirt to make sure you're appropriately pulling your shoulder blades together at the back of the motion. And then once you're done, you're just going to walk back in. And that is the standing cable row. Next, we're going to do a standing shoulder press. So for this exercise, we're going to grab an appropriate weight, and then we're going to bring it up to about shoulder height. I like to rest the corner of the dumbbells onto my shoulders. From here, I'm just going to press up overhead, bring the weights together, back down to my shoulders. Up and together, back down to my shoulders. So another way to do this, which depending on your shoulder mobility, may be to bring the weights a little bit more forward. Either way is fine, whatever feels most comfortable for your shoulders. Up and back down. So that is the dumbbell shoulder press. So this is the leg extension machine. There are quite a few adjustments on this, so just bear with me. So the first one is moving the seat forward and back. So there's a yellow lever here, and it does get a little bit sticky. So you want to push the lever in, and then the seat unlocks. So you can go back or forward. What I'm looking for here is I just want my legs to be slightly hanging at the end of this cushion here, as well as I want my knees in line with this kind of dot here where the machine is going to rotate. So next we want to adjust where the pad here sits along our legs. So the most comfortable place for it to sit is kind of just in this groove here between your ankle and your foot. So we're just going to pull this out, and then this moves freely. So you might want to do that before you sit down if bending forward like this is going to be hard for you. Next, this one here is going to adjust the starting position. So if you have less mobility in your knees, you're going to start out farther, and if you have more, you're going to start out back. That's just going to increase the range of motion for the exercise. So for me, this feels pretty good. Then I'm going to adjust my weight. I like to hang on to the handles and just extend my legs outwards. So lots of times I start with both legs, but a great way to do this exercise is with one leg. So what we're gonna do is just half the weight. And then the reason why we would do it with each leg individually is that so we don't let our strong leg do most of the work. So I'm just gonna extend my leg out, slow and controlled, and come back. Extend my leg out, slow and controlled. Do as many as I can on this side, and then switch legs to do the other side. And don't do that. So if you do get any increase in knee pain, just start up again and adjust things and see if there's a way that you can adjust it and see if it's more comfortable. But if you do get an increase in knee pain, just stop this exercise and talk to your exercise specialist. So that was the leg extension.